Hello friends, in today's video I will be talking about bone tumors, so let's get started. Here I have enumerated some common benign bone tumors which are osteogenic like osteoid osteoma and osteoblastoma, chondrogenic like osteochondroma, enchondroma, chondroblastoma, chondromyxoid fibroma, fibrogenic, non-ossifying fibroma and fibrous dysplasia, round cell like eosinophilic granuloma, and tumor like lesions which are simple bone cyst, aneurysmal bone cyst, and giant cell tumor. Some common malignant bone tumors are multiple myeloma, osteosarcoma, Ewing sarcoma, chondrosarcoma, chordoma, and Edmontonoma. As you can see here in the image, I have shown that some tumors arise from the epiphysis, some from metaphysis, and some from diaphysis, which I will be telling you about subsequently. Talking about osteoid osteoma, it's a benign bone forming tumor which is usually less than 2 centimeter in size, and on imaging, a small central needle surrounded by zone of sclerosis is noted. It mostly occurs in the metaphysis of long bones and involve the cortex of femur or tibia often. It usually affects patients between the age of 10 to 20, and the patient generally experience severe nocturnal pain which is relieved by aspirin or other NSAIDs. On gross appearance, these tumors are round to oval masses of hemorrhagic tan tissue. On microscopy, well circumscribed tumor formed of interlacing bony trabeculae made of woven bone with osteoblastic rimming is noted. The surrounding stroma is made of loose connective tissue which contains dilated and congested capillaries. The small size, well defined margins, and benign cytological features of neoplastic osteoblasts help distinguishing them from osteosarcoma. Coming to osteoblastoma. Osteoblastomas are locally aggressive tumors that are morphologically similar to osteoid osteoma but have growth potential and a size of more than 2 centimeters. Patients have non-specific pain which is not relieved by salicylates. Tumor located in the spine can cause numbness due to neurological symptoms. Talking about osteosarcoma. Well, osteosarcoma is a malignant tumor that produces osteoid matrix or mineralized bone. It's the most common high grade sarcoma of skeleton. It has a bimodal age distribution. Most cases occur between the age of 10 to 14, and a second peak is noted after 40 years of age in adults. The common location is metaphysis of long bones of extremities. Other sites include jaw, pelvis, spine, etc. Talking about pathogenesis of osteosarcoma, the inactivation of retinoblastoma gene is associated with a high risk of osteosarcoma development. Bone dysplasias, including Paget's disease of bone, fibrous dysplasia, enchondromatosis, and hereditary multiple exostosis, increase the risk of osteosarcoma. Lee-Fraumeni syndrome is predisposing factor for osteosarcoma development. Rothman-Thompson syndrome is also associated with increased risk of this disease. X-ray is the initial imaging of choice to diagnose osteosarcoma. Some characteristics of osteosarcomas on X-rays are the sunburst appearance and the Codman triangle, which is formed by elevation of bony cortex by the tumor that causes new bone formation, as depicted in the image by the arrow. Other investigative modalities are CT scan and MRI. Grossly osteosarcoma are bulky tumors which are tan and gratty and often with areas of hemorrhage and tend to destroy the surrounding cortices and invade the soft tissue. The conventional variants are osteoblastic, chondroblastic, fibroblastic osteosarcoma, and other types of osteosarcoma are telangiectatic, small cell, low grade central, periosteal, paraosteal, secondary, high grade surface, and extraskeletal osteosarcoma. Neoadjuvant chemotherapy, surgery, and post-operative adjuvant chemotherapy is done for the treatment of osteosarcoma. Most of the osteosarcoma metastasize hematogenously to lung, bone, brain, and other sites. Individuals without overt metastasis have a 5-year survival rate of about 70%, and with metastasis, the survival rate is less than 20%. Osteoblastoma, osteoid osteoma, and osteosarcoma are bone forming tumors and are very important topics for exam, as well as you get these cases in routine practice also. So, I hope this lecture was helpful for you all. Thanks and bye for now.